Welcome, everyone, to another podcast from Women Wired for Wellness. I'm your host, Dr. Nisha Chellam. Today's conversation is not only informative and enlightening, but it's also a very sensitive topic. I am talking to Dr. Jane Frederick, who is a reproductive specialist. The reason I find this topic very enlightening, and particularly this conversation, I should say, was very enlightening, is I thought of women's infertility from a metabolic standpoint, PCOS, or from a time standpoint where women wait a long time to start their family and find that infertility is an issue or a stumbling block they hit against. And so this conversation was very interesting because not only is it about women delaying their time before they decide to start a family, it is also about those women who unfortunately get diagnosed with a cancer, have to undergo treatment of cancer, which can potentially reduce their chances of fertility. But here is an option they have. And so this is a very exciting advancement in women's medicine. So this conversation, if you believe somebody is struggling with infertility or needs to hear this, make sure you share this conversation with them. Let's get back to who Dr. Jane Frederick is. She has practiced in California. She practices in California, I should say, from 1990. And she's both certified in both reproductive endocrinology, infertility, and obstetrics and gynecology from University of Southern California. She's a renowned speaker, speaking to colleagues about fertility preservation and the age and reproductive issues, with numerous publications including The Couple's Guide to In Vitro Fertilization and Trying to Conceive. She's held many posts in several organizations, and she was the past president of the Pacific Coast Reproductive Society and the American Society of Reproductive Medicine. Dr. Frederick has received a variety of honors for her outstanding work in the field and recently ranked among the top 10% in the nation from U.S. News and World Report. Without any further delay, here's my conversation with Dr. Jane Frederick. So welcome, Dr. Frederick. So happy to have you and actually very honored to have you. This is a very needed topic we have to discuss, and probably you can bust a few myths about what people think about infertility and the struggles getting pregnant. But before we get into that, can you tell me a little about your own story? How did you get to be a specialist in this field? It's a very, I think what you do is life altering for anybody who comes in contact with you.
Well, I've been working now as a fertility specialist for the last 30 years in my field. And I have over 2,000 babies out there that I've helped, families that I've been able to, start. And it's such a rewarding career. I remember when I decided to go into medicine, I just enjoyed helping women learn about their bodies. I really enjoyed reaching out to my undergraduate sorority sisters and the dorm students and telling them about, reproduction. And at that time, we were trying to prevent pregnancies in that age group. Right. And sexually transmitted diseases. And really, it was very rewarding to be part of that. And I ended up specializing in OBGYN. And through that avenue, I decided that infertility was the way to go, because in my specialty, we do medicine, we have surgery, and a lot of what our success is in the laboratory. And now being able to put an egg and sperm together and create an embryo that's healthy, and really give people more opportunities to have healthy pregnancies, that has really changed my field. So I started out 30 years ago as an infertility physician, treating mostly heterosexual couples trying to have a baby. And we had very limited opportunities for IVF at that time. Going 30 years later, now I treat a lot of patients that have cancer that come to me as men and women asking me, can you preserve my fertility? Can you help me freeze my egg and my sperm and my embryos? And we're seeing more and more cancer survivors that are coming back having their own children, which is really great. And from that, we transitioned into, now I see more single women who don't have a partner yet, and they just want to be able to freeze their eggs and know that down the road, when they do find their partner, that they have a good opportunity to have their own children. So the biological clock that's ticking we're trying to share that message that you don't need to wait, that you can preserve your fertility in your 30s and give yourself the best opportunity for when you're 40 to have a baby. I also treat a lot of patients who are having problems with recurrent miscarriages. So they get pregnant, but they just aren't keeping the pregnancy. I treat a lot of patients that are over 40, where their egg reserve is very low. And so nowadays we can actually test the embryo through genetic testing, and I can figure out which embryo is the miscarriage and which embryo is the healthy pregnancy, to allow those women not to miscarry anymore, and also to help the over 40 egg, because that egg has a tendency to not be healthy as well. So our laboratory technique has really enhanced my opportunity to treat not just the heterosexual couple. I have a lot of same-sex couples that are using an egg donor and a surrogate, 2 men, for example, or 2 women where the first partner will donate her egg to her partner's uterus, and they'll have that baby together. So there's really, the field is so fascinating that I have a hard time saying I'm going to retire, because I really enjoy what I do.
That's really fascinating. The part that I want you to discuss a little more in detail, what you just said, was when you said for people who miscarry, you're able to test and see what embryo will stay and what is going to cause the miscarriage. What are you talking about? Like when they preserve the egg, are you already fertilizing this in vitro and then looking at the embryo? Or
yes, I harvest the egg through IVF. I fertilize it in a test tube, and when it becomes an embryo, I can then take one of the cells on day 5 of the development of the embryo in the laboratory, and that cell goes to my genetics lab, and it tells me which embryo that I've frozen is actually healthy. So we're trying to eliminate the recurrent miscarriage, the embryo that's not going to be successful. I use the same technique for patients who have a genetic disorder where they carry the gene for cystic fibrosis or the hemophilia gene that affects all their male children. And I can actually take that cell from the embryo on day 5 in the lab, and I can, through the genetics lab, figure out which embryo is affected with hemophilia or affected with cystic fibrosis. And from that point, we can really enhance the ability to have a successful pregnancy.
So the other thing that also kind of caught my attention in what you said was, in the past, you were treating just heterosexual couples who had a problem with infertility. Now you're treating a lot of women who have cancer, and so they can, they preserve their eggs before they undergo the treatment for cancer. Is it because in the past people who had cancer just didn't know that they had the option, or there wasn't that option, and now, or are we having an increased incidence of cancer? Is the health of a woman actually declining, that we're having other diseases and we're having to preserve our reproductivity, or our cell lines?
So that answer has a lot to do with the technology that we have developed in the laboratory through IVF that allows us to successfully freeze an egg. So that was a very difficult process to learn. We were very successful at freezing sperm because it's a very small tissue, but the egg is a large cell filled with water. It's very fragile. So only in the last 15 years did we really develop something called vitrification, which is a rapid process of being able to freeze the egg without the damage that it would have. So that technology came to par. And then we're also seeing a lot more cancer therapies that are very successful. So we're seeing more cancer survivors, and those patients are asking, well, I'd like to preserve my fertility. And they're talking to their oncologist. The oncologists are aware that with egg freezing and embryo freezing, we can be very successful at preserving their fertility before they start the chemotherapy agents that will cause the sterilization. And that's always been true for men freezing their sperm, but it's only recently been successful for women freezing their eggs.
Okay, so there are two things about it. It's just the advance in technology and the fact that cancer therapy is far more successful, that women are ready to undergo, the physiological changes of pregnancy as long as they have that cell line.
That's correct.
That's interesting. But, being a practicing internist, one of the challenges I see is our biological clock and our career clock are parallel. And it's almost like you want to make it. And so I hate to call it balance. I don't think there's a balance. It's just a prioritization. So in your 20s, late 20s, and most of your 30s, your priority is trying to climb up the corporate ladder. And so this part of it goes down. And so more and more women are trying to get pregnant later decade of, the 30th decade and the early parts of 40. What is the advice you would give to someone who is on that track of, the career path? How should they improve their cell line, I guess the quality of the egg, and at what time do you recommend, what is the best age to freeze the egg for, future?
The best time to freeze the egg is in your 30s. Optimal time is below age 30. But most 20-year-olds are not coming to me with that thought in mind. They think they're invincible and will be forever. So I'm tending to see more patients between age 30 and 40 that are aware that our biological clock has been ticking. And freezing the egg at the time of age 30 or 35 really does allow a control over your reproductive health. And it just allows the egg to be in a steady state at that age in the lab, so that that patient has more options to find the right mate or finish her career and then focus on childbearing. I do find we do see a sharp decline in eggs after age 37, and we see a very sharp decline after age 40, with less success with in vitro after age 40 across the board. And the reason for this is because women are born with a finite number of eggs at birth. And the most number of eggs that we ever have are at the 5th month at 20 weeks in utero. Millions of eggs available, 6 to 7 million, but they drop as we are born and we go through our first period, age 12. Our last egg is at menopause, which is in our 50s, but 10 years prior to menopause, we start to see a lot of changes in the quality and quantity of the egg. So when I lecture to a lot of the alumni groups in the area here, I talk to them about what the egg quality and quantity is and how our biological clocks are ticking. I also recommend that they get their FSH, estradiol, and AMH blood levels checked. You can do that at your primary care physician. I usually recommend you check that on day 3 of the menstrual cycle. And it just gives you an idea of a sense of where along this biological track you are, and how far away are you from a critical state of menopause where there's no more eggs. So that's important. It's interesting. I do get a lot of calls from the mother of the graduate student because she knows that the biological clock is ticking, and her 35-year-old daughter is not yet ready to think about having a child. So that student comes in to see me and says, my mom's here. She told me to come, and I'm not sure why I'm talking to you, but I think it's interesting that the mothers of the graduate students are contacting me with this, plea to please, have a consult with my daughter. So it is important, and it's good to know that freezing an egg is not 100%. It's just an insurance backup. There's no guarantee the egg will thaw and fertilize when you want it and be normal. But if we don't take control of our reproductive health, which is part of what we do when I freeze your egg, I'm just stopping the clock at that point. If we don't take control, then when we're 40 and we do want to have a child, then I think there's a lot of regrets that we didn't have this opportunity in the past.
That is so true. I like that, the wisdom of the mother coming and saying, I do need this happening. And that's usually my audience. So any moms worried about their kids, I hope this will help them. So that comes to, when you say quality of the egg, what does that indicate? I mean, you said it's very fragile, it has a lot of fluid, but what are you looking for in terms of quality?
Well, an egg is a single cell in your body, 100 microns. It's a very large cell under the microscope. It's mostly filled with water. So when we freeze an egg, we are dehydrating the water and gently placing it in the liquid nitrogen for storage. When we rehydrate the egg at the time that it's being used, we bring it back to room temperature, get it to fertilize, allow it to grow in the laboratory till usually day 5. So the quality of the egg will depend on how well it goes through this process of freezing and then thawing and fertilizing. So that's the quality. It's hard to tell just by looking under the microscope what the egg quality is. But when you check your FSH hormone and you check your AMH and your estradiol, when you check those hormones, those are an indication of how good or how is the quality of your egg. Just like hemoglobin A1C will tell you what the blood sugars have been over the last 3 months in that person. Similarly, an FSH and an AMH hormone level will also tell us, well, what is the quality or quantity of the eggs that are remaining?
Got it. So I'm just looking at, what are the things or lifestyle measures a woman can take in order to preserve her egg quality? Have you noticed anything that they could do to improve their egg quality, or is it something that's genetic?
Yeah. So egg quality, so genetics do play a role. So you should ask your mom, what age did you go through menopause? If your mom says, around age 40, I stopped having periods, that is a red flag. So, so the genetics in the family tree, the mom, the grandmother, the aunts, the sisters, if you have a twin, those are all important questions that I ask when we get to the initial consult. Then, your weight, your body mass index or BMI, it's very important to keep your weight under control. And we see infertility issues in the obese patient, overweight, and we see infertility issues in the underweight patient. So I always encourage my patients to take a look at their body weight, body mass index or BMI, and try to get themselves to where they are at the appropriate weight. So that means you have to eat right, you have to exercise, limited alcohol. I don't recommend smoking, marijuana, vaping, things that we know have impurities in them and that cause problems with our absorption of our eggs. We know that women who smoke have go through an earlier menopause by 2 years because of the nicotine and the way it affects your estrogen and the way it impacts your eggs. So there are vices that you can change in your life. I think for a lot of women struggling with weight, that's one thing that we talk about a lot. And there are some patients, for example, with PCOS, polycystic ovarian syndrome, their weight is part of the PCOS. It affects their system and their inability to metabolize. So there may be a reason why you're overweight. Perhaps your thyroid is not functional. So you can get help and get a general checkup. Always want to be getting your PAPs and mammograms at the appropriate time. But I think most commonly, diet and exercise are something that we just don't focus on. And then stress level plays a big role for all of us. And I think for my infertility patients, who are very highly stressed, oftentimes just that stress in itself creates a problem when they're trying to conceive. So we need to focus on why we're stressed and how can we relieve our stress. Acupuncture has been something that I've always recommended for my patients who are under a lot of stress, just as a way to help them relax and focus on the problems and get through it. So looking at your lifestyle habits are extremely important when you want to preserve your fertility or try to get pregnant.
That's so cool. You just integrated medicine right there in it. So when it comes to the quality of the sperm, is it almost similar in terms of lifestyle measures that the male counterpart needs to do?
Very similar. We have a lot of obesity in men that affect their sperm quality, very much so. The vaping, the marijuana, the excessive alcohol, smoking, all of those play a big role. I have a lot of patients that used to inject steroids for bodybuilding.
Oh, right.
And for many, many years, they were on steroids, and now they're on testosterone injections, and testosterone injections will drop the sperm to zero. So there are a lot of medications that are being taken that can affect sperm quality. So I think it's important when you go to see the specialist and you're wondering why you're not getting pregnant, make sure that you are upfront with your history. If there was any steroid abuse in the past, or if you're on testosterone, make sure you let the doctor know so that we can use that information to help you be a success.
Nice. In terms of, I just want to make sure. So in terms of insurance, this is a huge part of the whole thing. Do you know which is the biggest insurance in this country today?
Which one?
Yeah, it's a trick question. It's actually GoFundMe.
Oh, yeah, that's probably true.
Yeah. So in general, if somebody were to, plan for this, what I've noticed about insurance, having practiced almost 27 years in medicine, one of the things I've noticed is the insurance has moved most of the responsibility of your health or disease management towards you, because you're still paying premium, and then you have this humongous deductible of 1,000, 6,000. So most people have what is called a health savings account. Can they plan for this through an HSA?
Yes, it's possible to use your HSA. I know that a lot of employers, I have about 30% of my patients that actually have insurance coverage for infertility treatment in California.
Oh, that's nice.
And there are a lot of states like Massachusetts, Illinois, that are covering infertility for all of their customers. So you want to ask your insurance company what options they have available. I know that Apple and Facebook are companies that are actually paying for women to get their eggs frozen as an employee. So you want to ask that as well. You know, I'm not married, but is there an opportunity through my employer to have egg freezing covered? But despite that, if you are someone that doesn't have any insurance coverage, we offer a lot of promotions for our couples and our patients. I have a program called CapEx, which is a loan program that over 300 IVF centers participate in, where we can help fund the IVF cycle with you at a very low interest rate. And it can occur immediately, so you don't have to wait years to get a loan. Mm-hmm. So there are many different options out there. Our group, our marketing group, has been very proactive in trying to get the word out that you don't want the financial burden to be a reason why you don't move forward with treatment. So you don't let that be a reason why you don't have a consultation. I always, after my consultation with the patient, I have my financial coordinator come next and reach out and let the patients know, first of all, what their insurance coverage is, and secondly, what are the promotions that we can help you with. So worrying about how you're going to pay for this should not be a reason why you don't see the specialist.
So you also mentioned about the freezing an egg is not guaranteed that it's going to be a baby. How does somebody who's financing this, is there like a count as to how many eggs might actually make it more successful? I mean, it may be an answer you cannot give, but I'm just asking. It's like so many eggs, if you retrieve and you're able to freeze it, and are you, do they pay per egg that's frozen, or is it like a group of eggs that is frozen in one nitrogen cylinder? I don't know. I have no idea.
Retrieval, at each retrieval, I try to get 10 to 15 eggs. That's a common number in the 30 to 40 age group. And we freeze them. It's one cost to freeze and store each year all the eggs that you have. I always recommend patients consider trying to gather up 15 to 30 eggs for their lifetime, because at least that gives us enough eggs that I can thaw down the road that hopefully will survive and produce an embryo. And we're obviously more is better. So if you find yourself not having a very good FSH level, or your AMH level is not healthy, then you may not have 10 to 15 eggs on the retrieval, and you might consider doing the process 2 or 3 times in order to gather enough eggs for the future.
Got it. So if they freeze these eggs, within how many years should they make that decision to use those eggs?
My patients come back to me within 5 to 7 years to produce a baby. So I don't recommend that you keep your eggs in the freezer forever, because just like any tissue in the freezer, there's always freezer burn that occurs. And the longer we freeze the tissue, the more likely it won't be viable. So it's good to get into the specialist, have your procedure performed, and then decide when you're going to come back and when is the right time for you to find your mate, or decide you're just going to have the baby yourself and be a single woman trying to have a baby. So I recommend within 5 to 7 years, most of my patients have utilized their eggs. Some of them never came back because they got pregnant on their own and they didn't need the eggs. So it's not a necessity to use these eggs. They're just there as your backup.
Very nice. It just gives you more options.
Yes.
And that takes away that stress. I think that's one of the things that drives the infertility stress, is like, am I going to get pregnant now? But when if this doesn't happen, I still have plan B, makes it so much easier.
I think as women too, we tend to put a lot of emphasis on, I got to find the right person, whoever that is, and it has to be tomorrow, and the baby has to come the next day. And we put a lot of that stress on ourselves as women. And I feel it's my duty, my job to alleviate some of that stress by letting them go out from my office saying, oh, wow, my eggs are in the freezer, and I can really focus on the person that I'm dating and not necessarily think I have to get married. So I always tell that to my patients. It's not a guarantee, but if I can, alleviate your stress, then that's the way to go.
That's cool. So how do you think we can get this message out to more women? Because I don't think a lot of them are thinking about freezing their eggs. It's like when they decide they want to have a baby, they just go ahead and try, and they try in their late 30s. Like I have 39, 42, 45, hoping to get pregnant. And like you said, when we do the LH, the FSH and the anti-Malarian hormone, we're not seeing such great, values. And that's very difficult. So how do you get this message out?
I think it's important that the family practice and the OBGYNs are talking to their patients about this. So I do a lot of seminars with the docs in my community, and I tell them, when you have a 35-year-old in your office, now's the time to ask the question. Don't wait for the patient to ask you. Bring it up in your consultation. Hey, have you thought about maybe checking your FSH and AMH, just so you have an idea of where you're at with your fertility, and making sure that your patient knows that there are options to preserve your fertility, even though that patient hasn't really talked about getting married or finding the right mate. So I think outreaching to the primary care and the OBGYNs is very, very important. I think it's also good to outreach to women, the consumer themselves. So I do a lot of social media webinars, and just letting patients know, the consumer know, that we have this standard of care out there called egg freezing that has now become an option, a very viable option for patients, and you should really think about it. My daughter, she turned 29, and last year she said, Mom, I want to freeze my egg. I hear you talking about it all the time. I hear all of your social media. She says, it's time for me to freeze my eggs. And she said, I'm going to do a blog on it on your site so people can realize it's really not that difficult. And she went through each day, and we recorded the ultrasound monitoring and how she did her shots at night. And then the surgery, and I went through and showed how the egg in the laboratory is identified, how it's frozen. And she really, it was very empowering for her to say, you know what, I did this at age 29, and I feel like I should tell others. And, that was really, it was very special as a mom to know that she felt confident enough hearing what I have been talking about, that she went ahead and did that herself to go forward. So now, we're spreading that rumor. We're trying hard, like your show, giving people, the consumer out there. If the doctors are not talking about it, then let's try to reach out to the women who really need our help.
Perfect. And that's very empowering that your own daughter is willing to do that. Most of the time they say the maximum darkness is right beneath the candle. Most of our family never listens to our recommendations. So that's really empowering to know that she sees your work and she sees the joy it brings to others. And talking about that, what is the success rate, if you can give me like a percentage of frozen eggs to pregnancy?
So if a patient has a good egg reserve, a good FSH, AMH level, and we can get anywhere from 15 to 30 eggs frozen, usually there's a 50-50 chance that they will have a successful embryo going full term. So it's really important to come early, come when you're young, and savor that opportunity for yourself.
Yeah, that's good to know, because I think you want your chances. You want really good chances, considering the trouble you're going to go through with taking the shots, making sure the eggs surface, and then they are captured in surgery. Then you freeze them. You really want it to be as high as possible. Is there any question you think I should have asked, I'm not asking, that will be important for somebody who's listening to this?
I think that you've touched on a lot of the factors that play in why women are struggling with this topic. And I think that the more the peer-to-peer talking about it with your friends, with letting the moms know about their daughters, I think that looking at your lifestyle and your healthy living lifestyle, I think has really benefited and will benefit a lot of the consumers out there. And I believe that if you're on the fence, if a patient is unsure about the technology, you should just make an appointment as a consultation and get in to see the specialist in your area. Ask those questions that are you're wondering about. You don't have to go through the process, but the more consultations that we can get to have people feel comfortable enough to come in and just to find out more info, to me, that's really important. So a lot of it is empowering women to feel comfortable to make a consultation appointment and just have a discussion. And from there, whether they go through with treatment or not, at least they feel like, I did go see the specialist. They told me the statistics, and then they make a decision. I oftentimes hear from my patients, they say, wow, now I'm 40. I wish that my gynecologist had said this to me when I was 35, or I wish that my primary care doctor had talked to me about it. So, I'm hoping to reach out to those physicians as well, to know that patients do want you to ask. Even though they don't mention about it, they are interested in the information. The oncologists have been very forthcoming to let patients know this is an option for you. Before you start chemo, that you could undergo an egg harvest with the IVF specialist. And I really appreciate that they work with us on that to help that patient have her own children. So it's all about sharing the knowledge and really empowering women to ask the questions.
I totally agree. And this has been very enlightening for me, because in my new position, I do see a lot of women who are young. They look young. And if you've noticed that the 30-year-olds look really young now, they look like 25. And but they are 39 and 40, pushing 40, and would love to have a baby. And it's good to know, like, when they're on that career pathway, or if they've been diagnosed with an early cancer, or even if they're currently not with a life partner, but this may come up later on. Those are all the great opportunities that it means they have a choice, which was not the case even, I don't think, 10 years ago. So this is amazing what you're doing, and thank you so much for doing that. And it was a real honor to talk to you today. Thank you again for coming on our podcast.
I appreciate that you're having this show and spreading the word. It's great.
Take care. Thank you.
Bye-bye.